It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show.
Well, folks, it's something we all have, and that's a smile. And that's what we're going to talk about today, our teeth. We're going to talk about cosmetic dentistry. How important is it to us and why it is so important? Joining me today are doctors William Pavlick and Dr. Kenneth Boyle from the Dr. Pavlick and Boyle General Family Dentistry. They're located in 111 East Broad Street in West Hazelton, PA. And folks, the phone number and their website's on the screen. You're going to want to call them when you hear this show. We have a special video for you. We have before and after shots. And we're going to talk about cosmetic dentistry in 1 second. But I want to welcome both you, Dr. Pavlick and Dr. Boyle, on the Sam Lesante Show.
Thank you, Sam.
Exciting show I think we have today. It's something how we progressed, okay, with looking good and feeling good and why it's healthy. But let's talk about your practice. What is it? What kind of dentistry do you practice?
Well, as you said, Sam, we are general family dentists, which means that we treat families of patients, and we do all facets of dentistry. We do root canals and dentures and certainly fillings and crowns. But we certainly like to specialize in the cosmetic aspect of dentistry as well, which is an up-and-coming field that I think is in demand right now.
And when you're talking about family dentistry, doctor, you're talking about children, adolescents?
Absolutely, absolutely. Children are a big part of our practice, and we do try to put a special emphasis on making them feel welcome. We have balloons and pencils and stickers, and if you start off really early, liking the dentist,
sure,
you have a lifelong no fear.
And that's what I want to ask you. When is it that you should bring your child to a dentist?
We recommend anywhere from 2 or beyond that point for their first initial visit, unless, of course, they're having some sort of a problem, then bring them in.
Why so young, at 2 years? You would think, why should I bring my child at 2 or 3 years old to the dentist?
Just to get them a little bit acclimated to the dentist and to come in and, to get used to the whole idea and make sure that there are no problems that maybe the parent isn't aware of.
Mm-hmm. And of course, as you get older, it's imperative that you at least get to the dentist a minimum of once a year to get your checkups. Is that correct, Bill?
I think so, Sam, and every 6 months is a typical recall scenario. Yeah, every 6 months, just to check everything, make sure everything is good. Dental problems do not evidence pain typically. The only time you have pain is the aftermath, when you have an abscess. So since you're not aware of pain, it is good to get things checked on a routine basis.
Now, why is it so important to get your teeth cleaned twice a year?
Most people, the #1 problem in America is periodontal disease. More patients lose their teeth from gum disease than from decay by far. Again, gum disease is an insidious disease that evidences no pain. In the beginning of gum infection or gum disease, it's very easy to treat and very inexpensive to treat. If it's left undiagnosed, it becomes very expensive to treat. Surgery is needed. And again, it's just a very good preventative to get those teeth checked every 6 months.
I want to add to that too, Sam. It's important also to do an oral cancer screening. And we do that as part of your regular recall visits. Each year in the United States, over 8,000 people die of oral cancer. So that's one of the important things that we touch on for people too.
You know, I'm glad you said that, because there's a lot that you can tell. Now, I'm not a dentist, of course, but from the many years of being around dentists, such as guys like you, and women who are in the dental field, looking in that mouth and being able to see certain things, it's amazing what your eyes see. Is that right, Ken?
Absolutely right. Yeah, the smile is the window to the soul many times, and it does impart confidence many times when people have a nice smile, and helps you advance yourself in your career and things like that, so yes.
All right, now speaking of smiles, okay, we're going to talk about cosmetic dentistry, okay, and we have a special guest who'll be coming on the show who I happen to know very well. But what do you mean when you say we talk about cosmetic dentistry? Bill or Ken?
Cosmetic dentistry is really the improvement of one's smile, and it goes beyond that, the improvement of one's confidence level. An interesting story that I have, Sam, is that my two of my children graduated from Penn State University, from the Schmiel School of Business, and this is about maybe 4 or 5 years ago, maybe 6. And when they went on their pre-job interview trainings, the first thing that their prompter told them was, For anybody that doesn't have white teeth, make sure you see your dentist and get them bleached. And if you have smile problems, make sure you get them corrected, because when you're going out to the job market, the very first thing that people notice is your smile. There were 2 Harris Interactive surveys done, and in those surveys, the 9 out of 10 people stated that they notice the smile before anything else, before the figure, before hair color, or before the eyes. So cosmetic dentistry has evolved to the point that it's in demand, and doing different types of cosmetic dentistry that Ken will talk about a little bit as well. The lumineers is the final piece of the pie that lumineers are able to improve somebody's smile without any pain, without much drilling, and it's certainly the Cadillac of cosmetic dentistry.
So let me ask you, Dr. Boyle, what exactly is a lumineer, and who is a candidate for them?
Lumineers are typically a very thin porcelain laminate that get applied to the outside of the tooth. They're contact lens thin, and the nice thing about them is that they're done pain-free, pretty much with very little, if any, drilling. There are no shots, no needles, no pain. They're painless, they're permanent, and they're pleasant. They're an easy procedure, and they are a way to really improve someone's smile.
Well, so we want to show you folks how this procedure is done, and my lovely wife Debbie recently had a smile makeover, and of course, you know, Debbie's very active now in Samson Productions here and does a lot of shows. But when we do this video, Debbie will join us and we'll talk why there are other reasons why you get cosmetic dentistry. So what we're going to do right now is Dr. Pavlick and Dr. Boyle will narrate what you're going to be looking at, and it's the before Debbie had her lumineers and after, and you're in for a real treat. So Sammy, why don't you run the video, and Dr. Pavlick and Dr. Boyle will take it from here.
This is Debbie's first initial visit, and we are, in Debbie's case, we had to just very gently micro-abrade her teeth. We are using a very fine diamond. We are not cutting into her tooth. We're not drilling away in or through the enamel at all. Very painless procedure for the amount of lumineers we did, and I believe they were 14. We had to adjust 2 teeth. Here you're seeing me adjust the lower canine as well. They had a little bit of a bulge, so we just tried to flatten that tooth out just to make room for the lumineer to fit. Again, very painless procedure for Debbie, and I'm sure that she didn't. I'm sure she'll tell you that she didn't feel a thing. Here we're just checking her bite again to make sure that the lumineers have enough space that when we put them on, they will, her bite will be correct as well. We're picking out a shade. The shade that we selected for is called an 020. It's a bleach shade, which is another way, by the way, of doing cosmetic dentistry, bleaching, and you'll see some examples of that as we go on. But this was Debbie's before and after, and that's the shade we selected.
Now here what I'm doing is we're getting ready to start the impression process, and what you can see is we place an impression tray inside the patient's mouth, and we gently form that in and around all the soft tissues there, and we place that in, and in lumineers we do use a 2-component system. We use a more firm impression material, which is the purple, and in a second here you're going to see the finer one, which is the second phase of the impression, which is a yellow material, and that flows over the surfaces of the teeth so that you get a very good detailed impression of the tooth surface so we can fabricate the lumineer. And here you can see the assistant expressing that into the tray in preparation for getting the impression into the patient's mouth.
And Ken, with these procedures, again, a painless procedure, of course, not many people have any difficulty in allowing us to take these kinds of impressions. They're not runny. They don't exude down someone's throat. These are pretty firm materials.
Mm-hmm.
You had a very cooperative patient there as well, I think, didn't we?
Yeah. And it usually stays in the patient's mouth for a period of about 1.5 minutes to 2 minutes, and they just breathe normally through their nose.
So it's not uncomfortable.
No. And And this is the final impression, and the yellow indicates all the detailed tooth structure that we then send to the laboratory out in California where they fabricate the lumineers.
Yeah, the only laboratory that at least does the Serenate lumineers, which is what we deal with exclusively, is in California. So that got sent out to the lab, and this is prior to us to us placing the lumineers. We are, I think, yeah, we're just pumicing or cleaning the teeth, if you will. We just want to get all the stain, the tartar off the teeth if there is any little stain or debris. So we clean our teeth very well. And then there'll be a process where we try in the lumineers with what's called a try-in paste. The procedure that Dr. Boyle and I did with the grinding, the selective grinding, and the impressions takes about 45 minutes, I think, Ken, would you agree?
Roughly.
And the insertion, which we're doing now, can take about an hour. Here we are, we're putting some of the lumineers in Debbie's mouth. Debbie had some, we actually did some crowns as well, some all porcelain crowns, but this is the insertion of the lumineers. As I said, this took us about an hour. We try them in with different colors pastes, make sure that we get a good result that the patient's happy with, and again, we're checking the bite to make sure that there's no discrepancies in her occlusion. And when this is done and when we get patient acceptance, we will put them in permanently.
And after all the hours of work, or minutes anyway, that's always an exciting time for the patient, you know, to get that new smile and to take a look at that. You usually have a real good response, and it's always a rewarding time to have the patient look at it and see that they're happy with what we've done.
Gone are the days in dentistry where, well, let me just... I don't know if you could hear, but I think you heard the wow from Debbie after she sees the final result. And as I was saying, here her before and after photos. They're great pictures, by the way. But gone are the days, Sam, I think, when dentistry was just all painful. To Ken and I, it's very rewarding to see people who come in for cosmetics, and number one, it's painless, and number two, they walk out of the office really hugging you and happy instead of holding their jaw.
Here we are on the set is Debbie, okay, and there's the smile. Hey, Deb, thanks for coming on the Sam Lesante Show.
Well, thank you for having me. I'm showing off my great smile. Thanks to you two gentlemen.
Thanks, Deb. Debbie, maybe you could explain why were you interested in lumineers?
Well, I think for a combination of reasons. I came to you, of course, for my checkup, my annual checkup, and I was interested in the bleaching process, so I had that done. And through that, I noticed I had some sensitivity in my teeth. I did have some recession away from some of the old crowns that I had in my mouth from the 70s yet. And so I had a combination of things going on in my mouth, and I was more concerned about the health of my teeth and my gums as well. And so after getting that nice bright white smile, my teeth were a little more sensitive for me, only because I had the receding gums. So I thought, well, now how can I keep these teeth nice and white? So that's when I started asking you what my choices were. And of course, the teeth whitened, but the crowns didn't whiten. So then I thought, well, now I should replace these ugly big crowns that are too big for my teeth from a recession. And so we just reviewed a couple things. So I think in each person's case, you're individualized as to what works best for you. Mm-hmm. But in my case, I was able to solve all of my problems that I had with the receding gums, the sensitivity, and then of course the whiteness. So now I never have to whiten my teeth again. I don't have sensitive teeth. I could drink cold water right from a bottle, and everything just looks great too.
Yeah.
And it was painless. I was so impressed. It was absolutely painless. The removal of the crowns was painless. The staff was great to me. It was so convenient. The time passed quickly in the chairs. I mean, the girls are all great, your assistants.
Thanks.
And you're so skilled, both of you, with everything. And I was totally, totally impressed with, what did I get, 14 lumineers?
I think there were 14 lumineers, and we did maybe eight crowns.
Right, and
yeah.
Everything fit well. So whoever does your lumineers for you, however you did it, I was just so pleased. It was within a month turnaround, I had all brand new teeth.
Yeah, it did take about a month, correct. And one of the things you touched on, Debbie, that I want to just repeat is the fact that the lumineers will never stain. The one advantage to a porcelain luminaire versus a bonding, for instance, is that you won't lose that color. That color will remain with you forever. It's not going to stain or plaque up at all.
And why is that? I mean, in other words, she could have blueberries. You could, you know, she doesn't smoke,
Wine.
thank God. But if she drink tea or wine or coffee, you know, which is the natural staining, and it doesn't happen with luminaires.
Correct. The porcelain, the luminaires, in fact, I don't know if any porcelain would stain, Sam, but certainly not Serenade porcelain. Enamel will, but not porcelain.
Well, in Debbie's case, you know, certainly the smile is important, but also it was for health reasons, right, Debbie?
Right. I was nearing the point, I think, with the receding gums. I was beginning to have puffy, swollen gums, bleeding, and I was considering even having some periodontal work done. And now, through having luminaires, my gums are healthier than they've ever been. So that was my main concern. I had seen people that had very, very severe cases of that. So that's what brought me to you in the first place, was the health. And then we found the solution. So it wasn't just for cosmetic reasons, you know, just how they looked, but wow, I mean, I got that as the bonus too. Sure. And as you saw at the end. The other thing, a lot of people now will ask me, did I have my teeth whitened or whatever? And what I find about how you did the luminaires versus how I've seen others is that they don't look like big horse teeth, you know, that old chiclet type thing. And I've been very, very pleased because they're very natural. I had big teeth before, but I mean, these don't look even, you know, larger, and they don't feel any different. I eat the same. I'm able to bite easier, actually, because I don't have the sensitivity. So I'm all the way around just so pleased with them.
Right. And Ken, I know that, again, with the luminaires, we used to do a lot of veneers, not to be confused with luminaires, and
right.
I think you certainly, we both had a lot of experience, but that, maybe you could elaborate, that we had to drill teeth maybe 2 millimeters into the enamel.
That's why she mentioned her teeth didn't turn out to be so big, because these are so thin. The chemistry today is down to the nth degree. They have this perfected, and we don't have to remove a lot of tooth structure to get these on. We can keep them thin, and therefore you get a nice result that's not big.
Right, because in previous years I did have a crown in the front of my mouth. I had a little tiny tooth, and it was you know, filed down to this little point, and if that ever fell off, boy, I had a fang. And now I just have my regular teeth underneath these. Right. So, you know.
And the bleeding gums, that was caused a little bit, Ken, right, by she had some old crowns, some old bulbous, thick crowns, and the margins weren't quite good anymore. Not that they weren't bad crowns, but they were done a while ago, and I think the margins, so by removing those, and I think we put on all porcelain crowns. I don't think you have any metal in your mouth any longer at all.
So and you also replaced all of my fillings that I had in my back molars, so I have a total white mouth.
Very natural. Yep.
You had mentioned before about you know, cosmetic dentistry, and it's not only for having a good smile, but important, all ages. Okay, it doesn't make any difference what ages. Okay, folks, if you just tuned in, you're watching the Sam Lesante Show. We're talking about cosmetic dentistry, and my guests are Doctors Pavlick and Boyle from the Dr. Pavlick and Boyle General Family Dentistry. The phone number and their website is on the screen at all times. If you have any questions about these luminaires, I suggest you call them, and they'll tell you the whole process and affordability and all that stuff. But we also have for you some other before and afters. And so what we could do right now is we want to put these on the screen, and as they're on, Dr. Boyle and Dr. Pavlick, you could tell us what we're looking at, okay?
Sure.
So let's, what are we looking at?
This is a case, Sam. This is a young girl who came in just for teeth whitening, and as I said, teeth whitening is also a big part of what we do. Most people know about Crest white strips in the stores, and certainly they can work to an extent, but they normally don't work to the extent that we have. Here you see a young girl who she bleached about 14 shades, and of course she's thrilled, and we didn't have to touch her teeth. She just wore bleach for about 5 or 6 days, and it worked out very well for her. So
you're saying this is not luminaires. This is what you did in the office to make them whiter.
Correct. This is just a bleaching case.
Okay.
Yes, again, part of cosmetic dentistry, but just a bleaching case.
And what do we have here? This is a
Bleach again. That's your bleach, I think. That was
Another
a bleach
bleach?
case. Yeah.
Yeah, that may be another. Oh, that is another bleach case, Sam. Yeah, a young boy who just had some orthodontics who had some yellow teeth, and you could see the little band around one of those lower teeth, and again that's purely a bleach case.
I have a comment on this case too, which is kind of an aside. I think the individual that came in originally had a little bit of gingivitis. They had some reddening in the gums on the left picture there, and it's interesting. But the bleaching materials we use today, they are a peroxide-based material, which is also in the family of things that help your gums. So if you look in the before and the after, not only did he achieve a whiter appearance with his teeth, but it corrected a little bit of his gum disease as well. And I thought that was kind of a neat benefit to having that done too.
We got him brushing better, but right, that was a good start.
Yep.
And
this is Kira, and we pretty much did the front 6 on the top and the front 6 teeth on the bottom as well. One of the nice things to notice here with Kira is that she had some crowding, and you might see that on the picture on the left there. The lower front teeth were kind of overlapped, and the nice thing about the lumineers here is that you can pretty much correct these and align the teeth, and these are the smile improvements that you can see from before to after, where you can get someone looking a lot straighter without having to go through orthodontics. This is a solution for a lot of people that don't want to put a lot of time into going to the orthodontist over a 3-year period. We can correct this in, as Deb said earlier, about a month's time.
wow.
And well, this is a lovely young lady that we did. This case, she had actually come in, Sam, for she wanted lumineers on top and bottom. We convinced her, however, to let us bleach her teeth first. And we got a pretty good result on bleaching on the lower teeth. And you can see it, I think you can see it pretty well, even though the picture with the lip line. But the bottom teeth are just bleached. She did not have to invest in any lumineers. We got her to such a good color that we were able only to concentrate on the uppers. And we did 10 teeth there, I believe, if I'm not mistaken. There were 6 porcelain crowns, and there are 4 lumineers. So combination case there of bleaching on the lower and some crowns and lumineers on the top.
Wow, that is amazing. And I thought they were all lumineers, because when you're looking at them, it's almost perfect blend from the top and bottom. That is amazing. So therefore, you may have some people who really don't need all lumineers, but you can do tops and maybe bottoms, or be selective with the bleaching and the lumineers. Is that correct?
Sure. And if you look closely there, the top teeth they're about a 2 or 3 shade whiter than the bottom teeth, which is very tolerable.
Well, you just about could tell it.
Yeah, many people's teeth, tops are sometimes a little bit lighter, so she tolerates that very well.
Look at the difference. My goodness.
There's
a person, whoever that person is, I'm sure that person is very happy with themselves. It becomes a personal thing as well, a self-confidence in yourself, and you just, sometimes people have something wrong with their teeth, and they're always, they're not smiling, okay. But when you have nice teeth, you're smiling. It means a lot for the self-confidence level.
Yeah, she was a great gal, great personality, wonderful lady. But I would venture to say that she's even slightly happier now than she was before.
So cosmetic dentistry has come a long way from before, correct? I mean, in the past, number of years ago, we did not have what we have today in dentistry.
Correct.
Now, that brings me to a question. As people are watching this, they're looking at you and they're looking at Dr. Boyle. Do we have other before?
I think
we have 2 more.
Sam, you want to run that one?
I think we have two more cases.
2 more?
Yeah.
Okay, there they are. Okay. This one is before and after as well. It was this bleach as well.
This one is a bleach, I believe.
Yes,
Yeah, it
okay.
looks like maybe just a bleach,
So
perhaps.
here again, no lumineers, but just a bleach. All right, and
This patient's important. This is one you want to get right. This patient is my wife.
oh boy,
It was actually one of my very first cases with doing lumineers, and she had come to me and said, honey, I noticed that everyone is starting to get some light teeth these days, and it's becoming more popular to improve your smile. And we had done some bridge work for her as the result of an accident she had many years ago. She had some damage, and she had some bridge work that was probably getting to be about 20 years old. Structurally, it was fine. However, the appearance needed some improvement. So what we went ahead and did was to reface, basically to put new lumineers over the top of the old bridgework, which was a great way of improving Michelle's smile. And it has worked out really, really well. And I think you can see the difference there from before to after. And it is a way to revitalize dentistry that has been done. It's old tire dentistry that can be revitalized as long as the underpinnings are okay.
Are they lumineers?
They are lumineers on the right-hand side over the top of the old existing bridgework.
And how about in the bottom?
That's just bleach. What we did was we went ahead and just bleached her bottom jaw and got them to match relatively closely to the lumineers in the finished picture there.
She's got to be very happy.
Yes, and like I said, I wanted to get that one right.
No, no, well, you get them all right. That's one thing, okay. I mean, but here again, we're talking about self-confidence, and, you know, there is you know, again, so, you know, it's affordability, you know, and I think when they call your place that you'll be able to do that.
Yeah,
Bill?
and just to add to that, Sam, again, without that case was done without having to go in and remove an entire section of bridge, which can be a little, if not painful, at least somewhat stressful for the patient.
There's one.
There you go. And this is a case we just recently finished, and again, a lovely young lady who had some old dental work done. I think she had a lot of old bondings on her teeth. In this case, actually, her bite was closed so much, Sam, that we had to work in conjunction with, actually with Dr. Brazo, one of the orthodontists in town, who helped us open up her bite. And then, again, we put a combination of lumineers / crowns on those teeth, and we did both the uppers and lowers, and that was another case where I think there were 26 units of
Young
dentistry
person,
done.
old person,
She's a very young middle-aged person.
Wow.
Not knowing her personality, you'd think she was 25 years old.
Let me
Again,
tell
a
you,
wonderful
that
lady.
person, again, I mean, you could see, I could just imagine how that person feels. Look at that. What a difference. My goodness. And painless, okay, here's another one.
Just some examples of how we can close gaps in teeth, Sam, if people aren't happy with some gaps. Just a quick before and after about closing a gap.
Wow. Here you can see the alignment. You know, we get a straighter alignment with these. There's, you know, smile improvement from left to right.
Can you comment? That's
Yeah, same thing. You know, someone that had some discolored teeth, maybe some old dentistry in there, some spacing, and over the top.
I'm amazed. Look at this. I am.
And this is again color and align. You can see that one incisor that sticks out again through lumineers, and these are just lumineer cases, just simply lumineers. There are no crowns in these last three. Or this
Here's
one.
Another one you can see where we, you know, lengthened the teeth, brought them out a little bit more. Maybe someone has a little smaller tooth structure and you want to bring it out and get a more attractive smile. You can see how you can do that and repair some of the old cracked dentistry that might be in there.
And folks, we're talking about painless here, okay? I mean, experience, and that's what I was alluding to before. The experience, I could see without question, you know, the number of people, the patients you've had. And they're walking out, you know, like when Debbie was finishing, she said, "Wow, they want to hug you, they want to thank you." But there's no reason to really have, you know, bad teeth with the advances we have in dentistry. Is correct, Bill?
Correct. And as I said, Harris poll shows that people's teeth are the #1 concern over cosmetic procedures. Teeth are noticed first.
Well, folks, I said before, we all have one, and that's a smile, okay? And this show is, we have doctors Pavlick and Dr. Boyle, and they're from the Dr. Pavlick and Boyle General Family Dentistry. The phone number and the website's on there. You want to do yourself a favor. All you need to do is call. They're two great guys. They're down to earth. They'll be more than happy to talk to you about your dental concerns. Anything in closing you'd like to say, Bill or Ken?
Just thanks for having us on today and giving us a chance to show people what's available today in cosmetic dentistry. Yeah.
Well,
And consultations, Sam, are free. Anyone who needs a consultation, we do not charge for a consultation visit. So if people do call, we'll be happy to go and do a smile analysis for them and lead them to what they're looking for.
so let me ask a very important question to my wife. Are you happy with those teeth, Debbie?
I haven't stopped smiling. And I'll be smiling for a lifetime, I think.
For a
they're
lifetime.
guaranteed,
When
right?
she came home, you know, and she just walked in a house and she's smiling, and I said, "Wow, what? Just exactly, wow." I mean, what else could you say?
Right.
You know, but the fact is that, you know, I'm saying, you know, did they hurt? Did it hurt? Did it do this?
No.
No pain. An opportunity of working through it. You know, a little time to do it, but no pain, and it worked out fine. Do yourself a favor, folks. You know, give them a call. Phone number's on the screen. It's 459-2263. Go to their website, consultation, no charge. Find out what's going on. They're affordable. You're watching the Sam Lesante Show, and remember, keep that smile really bright and keep it right, okay, with Doctors Pavlick and Dr. Boyle. We'll see you next time.